Welcome to the Sleep is a Skill podcast. My name is Molly McLaughlin, and I own a company that optimizes sleep through technology, accountability, and behavioral change. Each week, I'll be interviewing world-class experts ranging from doctors, innovators, and thought leaders to give actionable tips and strategies that you can implement to become a more skillful sleeper. Let's jump into your dose of practical sleep training. Welcome to the Sleep is a Skill podcast, where we dissect and analyze things that you can do to optimize your sleep and health. And today's topic is going to be all around the ear, the nose, and the throat as it relates to sleep, but particularly emphasizing the nose is what we're going to pay quite a bit of attention to in today's conversation. We got so in the weeds on this conversation that we decided we need to absolutely do a part two, because there's just far too much to pick apart on this really important topic, because we can be doing all kinds of things to improve our sleep, but if you're not breathing correctly throughout the course of the night, good luck getting good sleep. And what I think is exciting, though, is that we're going to be unpacking and understanding. But what is exciting is that there are so many new things that you can do to improve this problem. And thankfully, we're going to be led by our guest, Dr. Keith Matheny, and he is a Vanderbilt-trained ENT, and he has a practice in North Dallas that emphasizes rhinology and sleep in adults and children. He has a real passion, and I think you'll hear that in our conversation, is a real passion for the business aspects of this area, as well as new technologies and procedures in ENT. He holds numerous patents as well as local drug delivery implants for use in sinus and ear surgery, founding 2 device companies around these technologies. And he is also the founder, chairman, CEO of US ENT Partners, an ENT-focused group purchasing organization bringing savings of 20% or more on the high-cost supplies that ENT physicians use in their office daily, as well as a co-founder of Sleep Vigil, a company pioneering the concept of remote patient monitoring, RPM, for sleep apnea. Don't we need that? He also has numerous journal publications and has given numerous presentations on his clinical research and on various topics related to the business of medicine over the last few decades. As a creative outlet, he makes custom 3D printed jewelry within his company, Tuft Links, Tuff Links. He volunteers in his community, providing charity clinics for multiple school districts around his practice, serving on the local YMCA board, and even works with the Dallas Cowboys. So clearly our guest is very accomplished, quite a polymath, and I think you're going to really enjoy his out-of-the-box look at this important area of our health and our life. So let's jump in, but first, a few words from our sponsor. If you've been listening to the Sleep is a Skill podcast, you know how passionate I am about understanding the metrics that impact our sleep. Well, I've got some exciting news to share. I've recently started testing a unique product from our newest partner, Mode and Method. Mode and Method is created by Longevity Labs and focuses on human performance and self-optimization. Their collaboration with the leading health researchers and sports scientists has birthed HRV Plus, an innovative nutritional supplement. This supplement aims to enhance heart rate variability, or HRV. You know, we're always talking about this, a key biomarker of our overall wellness by improving the endocannabinoid system tone and reducing inflammation. HRV isn't just a measure of heart health, it's a reflection of our sleep quality. Now, speaking in generalities, largely a higher HRV can equate to better stress management, a quicker recovery, and optimal mental performance, all contributing to deeper, more restorative sleep. HRV Plus hopes to promote a balanced autonomic nervous system, aims to bolster your immune system, and is composed of natural, high-quality ingredients. And here's a unique opportunity that Mode and Method has offered to us. They're extending a special offer to the first 10 listeners who use code SLEEPISASKILL, all one word, at modemethod.com. Here's the cool part. you're not only going to receive a 15% discount on your purchase, but you'll also get an exclusive chance to participate in an innovative HRV study that's being conducted by Longevity Labs, along with, this part made me excited, a 15-minute HRV consultation. And this is absolutely guaranteed for all of you that do purchase that 15-minute HRV consultation, which don't snooze on that one. That could be very valuable. And for the first 10 of you, you will get access to that HRV study and be able to participate in that. So really don't miss out on this opportunity to further explore the science of sleep and make tangible improvements. We want this to be both objective and subjective. So visit modemethod.com and use my code sleep is a skill, all one word, and join in on the mission of revolutionizing our sleep. And welcome to the Sleep is a Skill podcast. Today's guest is actually not too far away from me over in Dallas, Texas. Keith, thank you so much for taking the time to be here.
Thank you so much, Molly. I'm excited.
I am really excited. So once again, this happens a lot to me, I feel, on these podcasts. I get to just have these opportunities to speak with such fascinating human beings. I feel so grateful. And you are one of them. It became very obvious just in our interactions leading up to this podcast. And then, of course, today, that the challenge will be to get all of our things that we want to address in this podcast in a short period of time.
Start the timer. Yeah,
start the timer. Exactly. So jumping right in. Beginning at the beginning, I wanted to just get a sense of a little bit of your backstory and how you found yourself such a, passionate person in the space that you're in now.
Yeah. So I am an ear, nose, and throat physician up here in Dallas. And so not very far away from you. And I love ear, nose, and throat. And so when I finished my training at Vanderbilt, 25 years ago, I set out to do all aspects of it. And ENT is a widely varied specialty. The ear surgery is very different than facial plastic surgery, very different than sinus surgery, different than head and neck cancer. We deal with pediatrics. We deal with all kinds of things, and sleep, of course. And so my practice really evolved into one where I took care of more and more nasal and sinus disorders. And then it finally dawned on me several years ago that the nose, literally and figuratively, is central in sleep disordered breathing, sleep apnea, and other similar type disorders. And so that's where my practice is today, is dealing with the nose, picking boogers, as people like to accuse me of, but also where nasal obstruction and nasal resistance affects sleep, which is a common issue.
So let's start there too, because I know even before we hit record, you were talking about some of the numbers of people that could benefit from some possible way. There's many ways to help improve our aptitude and our breathing through the nose, but maybe you can help kind of like Sherpa us through understanding why this is important, how prevalent it is. And I'm throwing you like 900 questions, but and
we're gonna have to
help us
understand.
Exactly.
No.
Piece by piece, the things that we can
I'll tackle that. So
you got this.
As most of your audience knows, up to 25% of the population on this planet has sleep disordered breathing.
Yes.
1 out of 4, at least adults. So there's billions of people walking around. As a medical specialty, certainly in the Western world, we have only diagnosed maybe 10% of those people that even have the diagnosis. And then of that 10%, we're maybe treating 10% in some form or fashion more than 90 days. So 1% of these people are getting treatment more than 90 days. That's horrible, because this is not just a social disease where your bed partner is inconvenienced because you're snoring. This is a fatal disease. As an ENT physician, as a head and neck surgeon, this is second only to head and neck cancer as the most severe disease, the most risky disease that I care for. So we've got to do better than that. And that's really, all joking aside, why I've become so passionate about it. The more gray hair I get is we're not doing a good job. We're not doing as good a job as we could. And we have a lot of diagnostic tools and therapeutic tools at our disposal that we need to bring to our patients. Now, the larger answer to your question, if you and I had done, I don't even know if they were podcasts 10 or 15 years ago, maybe they were just starting, but if we had done a live interview back then, and talked about whether or not Keith does sleep in his practice, I would have said, oh, absolutely. And what I meant, though, back then, or looking back, what I would have meant is that people with snoring usually are dragged in by their ear, by their bed partner to see me, and put on my doorstep and said, fix this person. And so I would do a physical exam, often ignoring much of the nose. We'll talk about that momentarily.
Sure.
And then send them for a sleep study. Back then, those were done in a clinic type setting at night. Now, most sleep diagnostics are done at home with take-home tests. There are many amazing ones on the market. And so I would go through those results with that patient and then refer them elsewhere for a CPAP machine, the dreaded Darth Vader mask that many people are prescribed, even though it is a great treatment in the right patient.
Yeah.
Or something surgical, which many of the surgeries, certainly 15 years ago, were very barbaric, and even worse, they didn't have durable results. The effects didn't last very long, the positive effects. And so many times I would never see the patient again because they didn't want to do CPAP, they didn't want to do a big surgery, or they wouldn't even come back after they went to get their sleep study. They were kind of corralled off by that physician. So I would argue that I was not doing sleep then because I wasn't taking the patient all the way to the end to a long-standing treatment. I was really just triaging them. I was listening to their story about snoring and sending them somewhere else for a sleep study and never seeing them again. That's not doing sleep. So the first step in our practice was 6 or 7 years ago when we decided to start doing some home sleep testing. And we made the commitment, we bought the equipment to actually start doing the watch pad. Many listening will be familiar. That's one of the best, if not the best, home sleep diagnostic test, in my opinion. And it's a simple wristband, finger probe. It's now, all that stuff is disposable and it interfaces with a phone app. So the patient can be in their own bed, in their own setting, sleeping in whatever position they want. There's not headgear and things, vests that are influencing the data that are affecting the patient's sleep. We're able to see how they really sleep and then get a good snapshot of what's actually going on. So that was a big step in our practice to get better at caring for sleep, because at least we were then in control of the testing, the diagnostics. So rehearsing that, patient would come in as a new patient, I'd order the sleep test. I would be the one reviewing the results with the patient and deciding amongst CPAP or dental appliances or some type of surgical procedure. And so the patients really liked staying in one place. But even then, once we got to the treatment, I would send them off to the dentist, or I would send them off for a CPAP machine because we don't do those in our office. And then I may never see the patient again.
Right.
So it still left something to be desired. So the next step after that, probably 4 years ago, is before COVID, we brought a sleep dentist into our practice. And this has become, even on social media over the last couple of weeks, a very hot topic. And actually, Molly, as we're recording this, there's a big sleep meeting going on.
Yes, there is.
That neither you or I are at, but many of our colleagues are there. And so in our practice, we've chosen to partner with dental professionals to fashion dental appliances in those patients where that's the best treatment for them. And that's beyond the scope of this talk. We have so much else to cover, but essentially those appliances keep the tongue from falling back and collapsing the airway during sleep. So it's a very, in my opinion, it's equivalent to the effectiveness of CPAP when I do my job and diagnose the patient correctly. And so that really was the next quantum leap in our practice. So now we do the initial appointment, we do the diagnosis, we review the results for that subset of patients that a dental appliance is good for. So pretty much most mild and moderate OSA, in my clinical opinion. So many patients could consider that. They're still in my office doing that. And those that know me, there's a lot of business reasons to do this too. So much of my career has evolved into the business sides of medicine. I do a lot of consulting and have companies for that. So this makes sense from the patient standpoint to stay in one place where I can quarterback it and supervise it, but it also makes good sense from a business standpoint. The latest thing that we've done, which I think is the crowning touch, is, okay, we get these people into treatment, whether it's CPAP, dental appliance, some kind of surgery. But then how is our treatment working? So I mentioned that we're treating 10% of the 10% that we've diagnosed, but are we treating them adequately? That's really the question. And it's kind of a scary answer. So I haven't even published some of this data yet, but one of my other companies it's called Sleep Vigil. And it monitors patients. I see you wearing your Oura Ring. I'm wearing my Apple Watch. So we use consumer wearables like that, Garmin's and Fitbits, and trying to check all the boxes to be inclusive here.
Yeah.
And we actually look at the patient's vital signs each night. And the reason that's important, so how it used to be, let's say I got the patient all the way to a dental appliance. So then the follow-up would be annual and often done by my physician assistant, who's excellent, but not even me.
Yeah.
And so how that visit would go is, Mr. Jones, Miss Smith, how are you sleeping? And they'll say, well, my spouse is punching me in the arm less because I'm not snoring as much, so I guess I'm good. And then they would ask me about my kids or my golf game or something. And then, okay, we'll see you next year. Well, are they good or not? The third-party payers in general will only allow us to do a sleep study, a follow-up sleep study, about every 3 years. So once every 1,000 days. Instead, using ongoing nightly monitoring, remote physiologic monitoring, or RPM, through Sleep Vigil, we're doing a sleep study, almost a poor man's sleep study, every night. So every day instead of every 1,000 days. And so it's been mostly good, seeing that our patients are maintaining good oxygen levels, respiratory rates, other vital sign parameters. But we certainly have identified people that we thought were good, that were not quite good. And as the whole sleep space moves more towards considering the hypoxic burden rather than AHI and other things that are falling out of favor to some extent, we realize that people that in that 1% that we're treating sometimes still have way too much hypoxic burden, and we've got to make some tweaks in their management. So that's the odyssey. So 15 years ago, I argue I was barely doing sleep. I was triaging snoring. Now I feel like with the diagnostics, the therapeutics, and the ongoing monitoring, now I'm actually doing sleep the way that we should.
Oh, I love that evolution. And I love that introspection and seeing where things had been, the path that you took to get where you are now. And then just based on how you're sharing, I'm sure some excitement around what's coming in the future and what you're building. But certainly just the use case, the need for this is so evident. I'm sure people listening have either considered that they might have some sort of respiratory disturbance while they're sleeping. They might be diagnosed with sleep apnea and maybe are being treated, or maybe not, which we see a lot of those, as you kind of also pointed
mostly
to.
Not.
They get like lost in the whole shuffle of things. So to kind of walk through a bit more of this experience for people, what could be possible, because it sounds like you're kind of laying the groundwork of this whole new paradigm where we can have some guidance for people versus, and not just guessing too. Now you're leveraging all these different pieces of tech, the poor man's kind of, at home testing. So with that, for those listeners, so even those people that can relate that say, oh, I am tracking with some sort of piece of tech, because a lot of our listeners are leaning tech savvy or looking to see how can they start to be in this conversation. Are there particular red flags? Of course, we know it's not diagnostic, any of these wearables per se, but from the sounds of it, you're in the camp that we can learn a lot from that.
Very good.
Yeah,
They're amazing
totally.
pieces of technology. So again, this is in one of my other lives, I run 2 medical device companies. And so we want to be very respectful and careful about the FDA, the Food and Drug Administration. So to my knowledge, other than the Apple Watch for monitoring abnormal heart rhythms and actual heart rhythms, EKG, most of these consumer wearables, the fitness trackers, are not FDA approved medical devices. Okay, so that's the disclaimer in case anyone from the FDA is here.
Yes.
On the other hand, we don't have anything else to use. So at Sleep Vigil, we like to look at the patient's oxygen, the respiratory rate, those types of things, which all these devices monitor, some better than others.
Sure.
There isn't a wireless, continuous pulse oximeter, or there are some, but there's not widely available FDA-cleared devices to do this. And I feel like this is, again, not just a social disease. This is not the inconvenience of snoring. This is life and death.
Yes.
If you aren't actually dying in your sleep from a heart attack or a stroke, you might be the next day dying in a car wreck or crashing an airplane. There's an epidemic. We talk, all of our friends, our little sleep buddies that we are, we talk about, just a couple months ago, how drowsy driving is the same as drunk driving. And I shudder to think about how exhausted I was during my training and sleep deprived, making major clinical decisions and learning how to do surgery. It's not okay. So we have to do something. And so at Sleep Vigil, we've chosen to use what's available to us now to at least get these trends back to the clinician in case they need to adjust the patient's treatment, whatever it might be, advancing their dental appliance, increasing the pressure on their CPAP machine, considering something else.
Absolutely. Are there key markers that you're seeing or you want people to kind of be on the lookout for with their wearables?
Great question. So, you know how at least I look at my steps and I look at whether I close my rings. And
sure, of course.
And so I think so many of our audience are similar. So what I'd like people to really pay attention to is their oxygen levels.
Yeah.
Now, some devices, let's just take the Apple Watch, for example. The motherboard, that's an amazing machine. The Apple Watch is much more complicated than the Apollo lunar lander. Okay. So what they landed on the moon with is way more simple than what I'm wearing on my wrist. That being said, the motherboard is pulled in a million directions, all the apps and functions and things. So it's not necessarily monitoring oxygen continuously, but pretty frequently. In the clinical trials that we did with Sleep Vigil, we used the Garmin device, the Vivo Smart. Again, this is not meant to be a commercial. This is really informational. And that actually dedicates more of the motherboard to oxygen monitoring. So we actually saw a lot more data points in a given night of sleep. And other things, the Oura Ring and all the other fitness trackers fall somewhere on that continuum. So I'd like our audience to start paying attention to the oxygenation during sleep. General rule of thumb, most of us sitting awake and breathing normally will have 98, 99% saturation of our red blood cells, meaning they're pretty much full of oxygen. And we, as clinicians, get worried when it starts to drop below 92, for sure in the 80%.
Yeah.
So 88, 82%. That usually indicates you have closed your airway or at least narrowed it and slowed down your breathing or possibly stopped it long enough for the oxygen level to drop in your bloodstream. And that's what apnea is a stoppage in breathing during sleep. So if folks are looking at their report card in the morning and they see several times that they're below 92% for sure, I think that's a reason to go visit your primary care physician, ENT, pulmonologist, someone that's familiar with sleep diagnostics to test that further.
Mm.
The same thing afterwards. If you are already on a treatment, and this is what I do. I, for many years, slept with a dental appliance myself. I no longer need it, but I still check my options. One of the first things I do every morning when we talk about my morning routine now. I look at that. This is an Apple Watch 6, but some of the newer ones will actually try to look at sleep staging, and there are many good apps on that front too. And what we mean by sleep staging is how much deep sleep you're getting, how much REM, rapid eye movement, or dreaming sleep you're getting. Those are markers of quality sleep, not just laying in bed and being in light sleep and trying to keep your airway open, but actually enjoying all the beneficial functions that sleep was intended to do. So oxygen, sleep staging, maybe looking at respiratory rate if your device looks at that. You can pick up times when your rate may really slow down. At the same time, you may see times when you're breathing very rapidly. If your device looks at heart rhythms, you want to make sure there aren't any abnormal heart rhythms that could be indicative of low oxygen as well. Our tissues were designed to function with oxygen. So when we have low oxygen, our hearts and our brains and nothing else works right.
Great. And the point you made about the sleep staging, because that's one of the things that I hear so many people getting stressed or concerned about. Are there particular things that when you look at the sleep staging breakdown that you say, all right, we definitely got to get you tested? Any major call-outs there?
Yeah, I think a broad sweeping statement would be if you're spending most or all of your night in very light sleep.
Yeah.
And to be a little more specific, stage 1, stage 2, then you're never cycling through the restorative phases of sleep. And those are the patients that I worry that sleeping for them is work. They're working to keep their airway open, and they're not allowed to go into deep sleep because they'll stop breathing. That's a red flag that I definitely would see your healthcare professional about ASAP.
And I so appreciate you speaking to that, because that's so actionable, and so many more people are beginning to track in some way, shape, or form. Are there problems with sleep trackers? Of course, there's some elements and what have you, but I think the breadth of information and the gamification and getting people in this conversation really helps to open the doors to those red flag elements that might say that, right.
What's wrong with it giving you an idea that you should investigate it further? I mean,
thank you.
I don't think any of these devices are claiming to be the end-all, be-all diagnostic test. But if you see trends where your oxygen is in the 80s most nights and
alert, yeah.
Why is that a bad thing? Of course, it's a wonderful thing, and it may be life-saving.
See, this is the type of guidance that is just so exciting to hear from a professional like yourself, where there's been kind of a apprehension from some people in the medical community. So I really appreciate you kind of leading the charge and looking to pioneer to have all of this information work in tandem and help support the absolute goal, which is to help people sleep better. So appreciate that.
We must do a better job. I mean, it's an epidemic. I mean, when we're recording this, we're at the end, we hope, of the pandemic, from the COVID virus. But what about sleep? I mean, with obesity rising, certainly in the Western world and everything, the numbers grossly eclipse anything that COVID, had. And we're not paying enough attention to that. And that hasn't gone away.
Yes.
That pandemic isn't over. It's just getting worse.
100%.
So, we must do a better job.
Okay. So then one of the things you really identified, and certainly you're well-versed in this whole area of ear, nose, and throat. And you also called out specifically this interest around the nose. So since we're clear, this is probably going to be our part one of many kind of deep dives with you, but just focusing in on the nose, I wonder if you can help shed some light, because I'll talk to certain people and they'll come in and they'll say, oh, the nose. Yeah, I have a breathe right strip. I'm good. Or they'll say, certain things and they're walking around with severe sleep apnea and a breathe right strip. So help us understand
Right.
all the pieces in between that people might be missing. And I'm not meaning to, belittle or kind of,
No, breathe right
simplify
strips
that.
actually, they work well in
There
that
you go.
right situation. They
Sure.
really do. So I think the general answer, Molly, is this is a multi-level disease.
100%.
So backing up, I mean, sleep apnea is really a disease because humans have a flexible airway.
Yeah.
The upside of that is we can talk. We can sit here and have a podcast. Most other mammals have a lot more cartilage and even bone in their airway, so it's not prone to collapsing. The only other mammal that has significant sleep apnea are bulldogs and dogs like that, but that's because of their extreme retrognathia, the small chin, how close the chin is to the back of their neck.
Sure.
Most other mammals don't have the collapse of the airway like humans do. And so really any spot of obstruction above the voice box, your Adam's apple, all the way up to the tip of your nose could be causing sleep disordered breathing. And that can be a fixed blockage, like a deviated septum. What the septum is the dividing wall between the two nostrils. And when we say the word deviated, we mean it's not straight, it's deviated off the midline, it's curved one way or the other, or both. Large tonsils would be a fixed obstruction in the airway, another example. But a lot of sleep apnea is from dynamic obstructions, meaning when we're sitting up awake, or if someone's sitting in their recliner watching TV, gravity is helping to hold all that soft tissue apart. But when you lie flat on your back, gravity is helping, and especially as we get into deeper sleep and we lose our muscle tone, all of that just collapses. So the tongue, again, tonsil tissue, even as we get more mature and we put weight on under our neck, even this level of the airway can collapse in deeper stages of sleep, especially flat on your back. So it's natural in my mind for an ear, nose, and throat physician who deals with this to lead the charge in dealing with sleep disordered breathing. Many of our pulmonology, our lung doctor colleagues deal with sleep apnea, and they're very good. But that never really made sense to me because they deal with the airway below the site of obstruction. All the obstruction in sleep apnea is up here. And so it's really important for my colleagues and I to pay attention. And I'm saying that because I was guilty of looking past the nostrils. You were joking about breathe right strips.
Yeah.
But even the strength or weakness of the cartilage in the nostril can have a significant impact on the airway, but sleep apnea. And so a proper examination of these patients starts literally at the tip of the nose. There's a simple maneuver that we do, and I think we're getting better as a specialty, ear, nose, and throat specialty over the last 5 to 10 years, of looking at nasal valve collapse. So the simple thing is, if you sniff in hard and your nostrils pinch in, that's a form of nasal valve collapse. And it's dynamic, meaning it's happening during movement. You're not walking around like this. It's just when you really inspire deeply. So breathe right strips, for example, help that. Those are springs that hold the nostrils open. And there are other technologies we may or may not get into here. We may have to do that in an episode too.
Yeah.
That can strengthen the cartilage so that doesn't happen. Right behind that, there are 2 other potential culprits. We talked about the deviated septum. The third leg of that tripod is how I like to describe nasal obstruction. The nasal valve, the deviated septum, there are turbinates. So turbinates, if you've ever seen we're in Texas, so you see a longhorn skull just out in the pasture somewhere. So when you look inside the nose, you see these little hooks on the side. Those are the turbinate bones. The same word like a wind turbine, a big windmill for energy. Those are natural structures that filter and humidify the air in the nostrils and direct the airflow back. but they're also the first responders for allergies. So many of us have very large turbinates. They're very engorged and swollen from allergies. So that's blocking airway. Right behind that, you have potential adenoid tissue, which is a big player in the pediatric sleep apnea population. Adenoids are tonsil tissue, just like you have in your throat, but higher up in the throat, in the back of the nose. And then, of course, we talked about the tonsils. We talked about the base of the tongue that can fall back, especially when you're flat on your back, closing the airway there. So we must look at all of those, but all of those are potential sites to intervene to help these patients.
Wow, so knowledgeable in this space. And I guess I have concerns too for so many people when they might want to find someone like yourself that is that knowledgeable to this level and really aware of, and maybe not practicing like the 15 years ago conversation. How can people find someone like yourself, or with Sleep Vigil, how far does that extend so that people can have access to someone that's in this conversation?
That's a great question. So I like to think that most of my colleagues, are certainly easily capable of diagnosing. And so where I practice here in North Dallas, my patient population is so well educated even before coming in. And so I think in your hypothetical scenario, a patient could be, amassing their fitness tracker data and looking at how much low oxygen they're experiencing, hypoxia they're experiencing. And I guess thinking about whether their nostrils collapse, whether a breathe right strip helps them, whether sleeping on their side or sleeping up in a recliner helps them. So coming in and talking to the physician already armed with that data, knowing that any or all of these levels could be contributory, I think that forms then a symbiotic relationship where the physician can really say, okay, these are the 5 or 6 spots in your airway I'm worried about. Let's do the sleep study, see where you stand on that continuum. And then these are all potential spots I could help you with. That's why CPAP is the gold standard, right? Because most of the time, pressure is either completely or partially delivered nasally.
Yeah.
So it does theoretically hit all levels. In actuality, what my colleagues and I often see in ENT, though, is that nobody looked at the nose. And so they slap a mask on this patient and they're putting them on very high pressures simply to overcome a deviated septum or inflammatory polyps from chronic sinus problems. And the pressure is never getting down where it needs to go because the front door is blocked. So it's become more and more of a passion of mine to shout that from the mountaintops that we must look at the nose. As I said at the outset, the nose is central, figuratively and literally, in sleep disordered breathing. So it must be examined and addressed.
Wow. Okay. So it's becoming very apparent to me that then in our part 2, what we can do is kind of walk through what are those things that we could dive into, because this is helpful. This is setting the stage for us of what to look for, what to be aware of, how to take the steps to start kind of logging some of these things that you are noticing for yourself, so that when you do go into your doctor, that you have wide array of information of what seems to flare up certain things, what patterns have arisen, so that they can help give you the best, kind of guidance and walk through the process.
Yeah,
great.
Absolutely.
Okay. Well, then in that case, one of the things that we found that people seem to really like a lot out of these episodes is then with someone as knowledgeable like yourself in this area around sleep, they want to know, well, what are they doing with all of these things of managing sleep? Because it seems to be an all-day affair throughout the day and night. And what we do matters in our results with our sleep. So I'm super curious to hear your responses on some of these and what we can learn. So our first question that we ask everyone is, what does your nightly sleep routine look like right now? And I'm sure it's evolving. You seem very
So first of all, I'm a male, so I'm a terrible patient. Secondly, I'm a doctor, so I'm the worst patient of all.
Love it.
And so
disclaimer.
I have gotten better. The only patients worse than doctors are nurses, right? I'm saying that in love. We're terrible at giving advice all day long and not following that advice. Okay.
Totally.
recently, I've realized, I guess really over the past year or two, during our band of friends and all the banter that we have and the exchange of ideas at meetings, sleep is really important.
Yes.
Not just preventing sleep apnea, right? But having enough sleep. Okay. So I'm answering your question roundabout way.
No, I appreciate this.
So my nightly routine, this sounds crazy, but in the medical field, it's definitely always considered a badge of courage how little sleep you need to function. And that's reinforced, and it's almost like you have a Purple Heart if you don't sleep very much. And I'm a very busy person. I still try to practice medicine full time, and I run 3 other companies full time. So I kind of have 4 full-time jobs and a whole bunch of other side gigs. But I used to take that as a badge of courage, and I realized it's actually stupid. And when I start looking at the data on dementia, my family history, so many on both sides of my family tree eventually developed Alzheimer's. And I saw how horrific that was. Most of them lived a long time with that dementia. Or you think about cardiovascular disease. There are things that I can do now. I'm in my early 50s to make my 60s, 70s, 80s so much healthier. And probably the main thing I can do, short of, exercise, is sleeping.
Yes.
Literally trying to sleep. So my latest goal is to sleep more than 6 hours a night. And I try to get 6 to 7. I mean, really, not laying in bed for 6 hours, but 6 to 7. Okay, so that's my first goal. And so I know you'll be happy about that.
I'm totally happy about this. And where was it at before? Because it could have been, given being in the medical field and all of these entrepreneurial ventures, sounds like it can get lower.
I didn't used to sleep a lot. So I used to probably honestly sleep less than 5 hours a night for a long time. And so probably some of that damage is done, but the human body is resilient. And so I think setting up good habits, it's never too late, right? I think a lot of the negative effects I had probably from so little sleep can be improved by committing to that. Now, before that, and I know I'm hitting all your bullet points and things.
No, I appreciate it.
All the time.
Yeah.
So what does it look like before going to sleep? Okay. So because I work long hours, oftentimes I would be eating a meal, having a glass of wine, whatever, watching TV in bed, and then just conking out. And there's about 10 sins right there, right? Yeah. So trying to clean that up, and this kind of answers the next question about what's on the nightstand. Not much on purpose, because
love that.
I try to read instead of watch TV. I definitely try to eat and cut off any alcohol or anything well before, at least an hour or two before sleeping. The one thing that I just like to read on my iPad, and that's unfortunately a lot of blue light, and so I could probably improve that somehow. But at least I'm not sitting there watching TV. Yeah. And so I try to read. I personally usually have, some challenge throughout my day, or something I'm working on, or some new invention I'm thinking of. So I try to focus on one thought right before I drift off and let my subconscious mind work on that all night long. So that's kind of me. I like to, I really never need an alarm. It annoys my family extremely, especially on vacation. I always wake up very early, so I typically naturally wake up about 4:30 or so my time, which means that I have to really commit to not staying up late to watch overtime of a hockey game or whatever. Even the news, I really need to commit to that 9:30, 10 o'clock hour, at least getting towards bedtime, to be able to get my 6 hours, because I'm going to wake up, before my alarm. But the other thing at the other end of the night that you and our friend in New York, Teresa Power at Sleep Vigil in New York, Emma Cooksey, several people have challenged me those last little minutes before my alarm goes off. What I've tried to do for the last couple months is just doze back off and get some REM snacks, like little snippets of additional REM sleep. And the way I think of it, I don't know if this is medically true, but we do know that sleep is cleansing.
Yes.
It's really cleansing for the brain. So we do know that scientifically. So I like to think that during my 6 hours, my brain's sweeping all the dust into little dust piles. And those last couple snippets of REM in the morning before I finally get out of bed is like scooping it up in the dustpan and disposing of it. Just committing to that, because I have a lot of energy. I have a lot of things on my to-do list that roll to the next day and the next day. So I'm usually ready to go in the morning. But committing to that, I think, has made a big difference for me, those two things. And then another thing that you always preach about, which I really believe, is I try to see, we live in Texas where there's a lot of sunny days.
Yes.
So some of our friends in other places, it's harder, like Seattle or Maine or whatever.
Yep.
But I try to see the sunrise and the sunset every day. And sometimes it's through a window.
Yep.
I'm still working or whatever, or in an airplane or whatever. But at least I try to look at it.
Yeah.
When at all possible, I like to get out so that ultraviolet light, the sunlight's actually hitting my retinas, my skin. And I think that's also helped me sleep better too, is committing to that. And that's just good in general, to see every sunrise and sunset. You never know when's your last one.
I love that.
Absolutely. So those are the main changes that I've made. A lot of it since we scheduled this and you challenged me to. And I'm here to say, I think it's made a big difference already. I really do.
Well, that is just music to
my...
You
should be a sleep coach. I think you have a future in this.
Thank you.
Maybe you should start a podcast.
Maybe I should, yeah. I appreciate that. Oh my God. You have no idea. I mean, I literally, for me, I was just on a podcast earlier today sharing about the journey that it's been for me, kind of entering into the sleep space years back. And it's one of these areas that I feel like we're clearly very aligned on, that you can easily just give your life to fully, because people would be like, oh, aren't you going to get tired of talking about sleep at some point? Absolutely not. It is so rewarding, and the difference that is made for all of us, right? And there's always things that all of us can do to up-level these things, especially from an entrepreneurial space, or if you're taking on big things in the world, the more things you're starting to juggle, what tends to go for so many people is that sleep. And so I love to think of it as this kind of barometer of the workability of our lives, and it's going to be dynamic, and sometimes it's going to, ebb and flow. Sometimes you think, oh, I got this handled, no problem. And then something happens, and then suddenly can get thrown. So to be a player in this conversation is amazing, and to be curious and, testing and trying different things. So I love that. Did we miss anything at all that's in your space? I know we touched on the nightstand question. Is there anything else like that you're using, apps, supplements, anything for your nose? Any call outs at all there?
Yeah, I'm fortunate. I don't have any nasal obstruction. My allergies are less than a lot of my North Texas friends and family around here. But no, I'm not opposed to some of those at all. I recommend some in my patients, but yeah, I try to just do it naturally. Really take care of my circadian rhythm, be disciplined about my schedule, and especially my eating habits and things like that, alcohol habits, exercise. We didn't even touch on that, but yeah, I think that's crucial to have a regular exercise routine to then sleep well, right? First of all, you're just healthier. You may be a little more tired. It's easier to fall asleep for those of us that struggle with some insomnia. I don't, but I know so many people do. Yeah, I mean, there's just so many changes. I think we did great for episode 1. There's probably about 10 episodes, but
100%. No, absolutely. I'm so excited for more. And then the last question would be, what would you say has made the biggest change to your sleep game, or maybe the biggest aha moment in managing your sleep?
Yeah, I think, kind of the same thing, realizing that I was being an idiot.
Totally.
And taking it as a badge of courage that I didn't need as much sleep as the other person. I was getting the jump on them. I view it now as, think of an elite athlete, not that I am, think of an elite athlete and how much they train years maybe for a 45-second race in the Olympics. And I feel like sleeping is preparing for whatever this next task, this next mountain you want to climb. You're actually training for it by sleeping, and probably a heck of a lot more productive than if you'd stayed up working or doing whatever towards that goal. You're a healthier person mentally for sure, and physically too, to do whatever that task is.
I love that. Oh, so well said. And so for the people that are listening, and then you've inspired or kind of sparked some pathways for action for them that they want to explore. Oh, maybe I need to get tested. Maybe there are some things that I hadn't considered that I could do from an anatomical perspective, or just get some more data or have some more eyes on me. What are the best steps for them to take to kind of have access to some of the information that you're sharing?
Yeah. So really, I'm very active on a couple of social media platforms, but mostly LinkedIn seems to work for me. And I always am happy and very active on the messaging part of that. So in different parts of the country, I have so many like-minded healthcare professionals, physicians, and mid-level providers and things that could walk you through this process. So everyone doesn't have to come to Dallas to do this. There are so many good people around the country and the world, really, that are passionate about sleep. So I think finding me on LinkedIn, I think you'll probably put that in the show notes.
Absolutely.
And then I can kind of direct people from there. That would be the best way.
Okay. Yeah. Highly suggest following Keith on LinkedIn. I've been really, really enjoying the content that you're putting out. And again,
likewise.
Yeah. Your passion, your interest, your excitement, you're just, kind of sharing and bringing people along for this journey versus, just relating to this as a chore or something that people have got to figure out on their own. No, you're absolutely creating and carving a new path of how we can newly think about some of these disruptive pieces to sleep, and then actually get to see the other side of it, which is like, the colors are brighter, the world is improved when you actually
grass is greener.
Grass is greener when you actually treat this wild thing. And to your point, and you started this episode with such conviction around, because we see that it can be almost belittled or, snoring, it's going to be jokes, and we see it in memes and what have you. And that's just kind of the tip of the iceberg of what is lurking underneath that. And if it goes untreated, It's a real epidemic. So big deal.
It's a big deal.
So thank you so much for taking the time to share some of this and setting the stage for our next part 2. And we spoke before we hit record that I very well might be seeing you in your office in Dallas. My husband's very excited to kind of have your eyes potentially on some of his things that he wants to improve.
We'll let him go first.
Cavity. Yeah,
we'll let him be the guinea pig. Yeah.
Okay, this is going to be very fun, that part 2. All right. Well, I appreciate you. And then we will be in touch for that next segment.
Thank you, Molly. Appreciate it.
You've been listening to the Sleep is a Skill podcast, the #1 podcast for people who want to take their sleep skills to the next level. Every Monday, I send out something that I call Molly's Monday Obsessions, containing everything that I'm obsessing over in the world of sleep. Head on over to sleepisaskill.com to sign up.